I'm going to read another chapter from the book on Jung by Anthony Stevens. This is chapter 6, Therapy. It is not possible within the confines of one chapter to give an adequate account of the profound transformation that Jungian analysis at its best can bring, or give anything more than a cursory outline of the principles on which its practice is based. However, the task must be attempted since the school of analysis that is carried on in Jung's name is his chief legacy to our culture. The innovations introduced by Jung have had an influence which extends far beyond his own school, and it's fair to say that this influence has been benevolent and humane. His initial formulations arose mainly out of his own creative illness, as we have seen, but they were also a reaction against the stereotype of the classical Freudian analysis, sitting silent and aloof behind the couch, occasionally emitting ex cathedra pronouncements and interpretations while remaining totally uninvolved in the patient's anguish and suffering. Instead, Jung offered the radical proposal that analysis is a dialectical procedure, a two-way exchange between two people who are equally involved. Although this was a revolutionary idea when he first suggested it, it is a model which has influenced psychotherapists of most schools, though many seem not to realize that it originated with Jung. Jung's contribution to the practice of psychotherapy can be considered for convenience under four headings. 1. His approach to mental illness. 2. His attitude to patients. 3. The principles and techniques he advocated in treatment. And 4. His views on the role of the therapist. Illness. In formulating his approach to mental illness, Jung was reacting not only against the concepts of Freudian psychoanalysis, but also against the ideas which prevailed and to a large extent still prevail in conventional psychiatry. The truth is that Jung's experience was wider and his mentality more far-sighted than was generally the case among practitioners of either of these disciplines. Freud had tested and, to his own satisfaction, confirmed his hypotheses on the basis of his analysis of a small group of middle-class Austrian patients, mostly women suffering from hysteria, a condition much in vogue at the end of the 19th century but seldom diagnosed today. Jung's patients, on the other hand, came at least initially from all walks of life and exhibited practically every condition described in Krafft-Ebing's textbook of psychiatry. Moreover, Jung based his formulations not only on himself and his patients, but on an extensive study of myths, comparative religion, and anthropology in a Herculean effort to establish universal truths which would be valid for all human beings, irrespective of their class, race, or creed. Above all, he did his best to remain undogmatic to the end. When his English colleague E.A. Bennett told Jung in 1951 that he was writing an article about him for the British Medical Journal, he said at once, "Whatever you say, make it clear that I have no dogma. I'm still open and haven't got things fixed." The open-minded humanity of his approach to mental illness was evident from the beginning of his work at the Burghazali as Bleuler's assistant. Burghazali, anyway, probably saying that wrong. Unlike the great majority of psychiatrists at the time, Jung, as we have already noted, actually listened to what his patients said to him, however deluded or hallucinated they might be. As he wrote much later, in many cases in psychiatry, the patient who comes to us has a story that is not told, and which, as a rule, no one knows of. To my mind, therapy only really begins after the investigation of that wholly personal story. It is the patient's secret, the rock against which he is shattered. If I know his secret story, I have a key to the treatment. In therapy, the problem is always the whole person, never the symptom alone. We must ask questions which challenge the whole personality. By attending carefully to what his psychotic patients told him, he says, I realized that paranoid ideas and hallucinations contain a germ of meaning. A personality, a life history, a pattern of hopes and desires lie behind the psychosis. The fault is ours if we do not understand them. It dawned upon me then for the first time that a general psychology of the personality lies concealed within psychosis, and that even here we come upon the old human conflicts. Although patients may appear dull and apathetic or totally imbecilic, there is more going on in their mind and more that is meaningful than there seems to be. At bottom, we discover nothing new and unknown in the mentally ill. Rather, we encounter the substratum of our own natures. This was even more true in the case of neuroses. The psychic processes of neurotics differ hardly at all from those of so-called normal persons. For what man today is quite sure that he is not neurotic? Although he learned all about making psychiatric diagnoses at the Bergalzi, he felt the procedure to be of limited usefulness. Clinical diagnoses are important since they give the doctor a certain orientation, but they do not help the patient. The crucial thing is the story, for it alone shows the human background and the human suffering, and only at that point can the doctor's therapy begin to operate. The old pathological approach, which persists in general psychiatry to this day, describes mental illnesses as distinct entia, each presenting a specific and clearly defined clinical picture. Jung considered this to be rewarding up to a point, but it had the disadvantage of thrusting all the inessential features of the condition to the forefront, while covering up the one aspect that is essentially, namely, the fact that this illness is always an intensely individual phenomenon. In very general terms, he believed schizophrenia, psychosis, and hysteria, neuroses, to be extreme expressions of the two basic attitude types: extreme introversion resulting in a withdrawal of libido from outer reality, leading into an entirely private world of fantasy and archetypal imagery, and extreme extroversion, leading away from a sense of inner integrity to an exaggerated concern with one's influence in the world of social relationships. In other words, schizophrenics live in the unconscious, while hysterics live in their persona. Put in its widest conceptual context, therefore, mental health and mental illness are both functions of homeostatic balance or imbalance between the needs of the individual and the demands of the collective. When people become neurotic, it is because divisions have opened up within them. Conscious and unconscious processes no longer operate in homeostatic balance. This disalliance with the unconscious is synonymous with loss of instinct and rootlessness. But if we can successfully develop that function, which I have called transcendent, the disharmony ceases, and we can then enjoy the favorable side of the unconscious. The unconscious then gives us all the encouragement and help that a bountiful nature can shower upon a man. It is true that Jung's emphasis is invariably on the intrapsychic life of the individual, but he does not ignore the importance of adaptation to the demands of society. Thus, from the psychological, not the clinical point of view, we can divide the psychoneuroses into two main groups, the one comprising collective people with underdeveloped individuality, the other individualists with atrophied collective adaptation. The therapeutic attitude differs accordingly, for it is abundantly clear that a neurotic individualist can only be cured by recognizing the collective man in himself, hence the need for collective adaptation. Jung's view that psychiatric symptoms are persistent exaggerations of natural psychophysiological responses was not only shared by Freud, but has been reaffirmed by contemporary psychiatrists who use ethological concepts in their approach to mental illness. For example, Dr. Brant Wenegrat of the Stanford University Medical Center in California sees all psychopathological syndromes, whether psychotic, neurotic, or psychopathic, as statistically abnormal manifestations of innate response strategies, his term for archetypes, shared by all individuals, whether they are mentally healthy or ill. Jung carried this insight one very important stage further, arguing that symptom formation is itself a product of the individuation process, that illness is an autonomously creative act, a function of the psyche's imperative to grow and develop, having to proceed in abnormal circumstances. Neuroses is thus a form of adaptation, albeit inferior adaptation of a potentially healthy organism responding to the demands of life. Because of some obstacle, a constitutional weakness or defect, wrong education, bad experiences, an unsuitable attitude, etc., one shrinks from the difficulties which life brings. Individuation is distorted or goes awry because the individual experiences difficulty in achieving a mature adjustment because certain archetypal needs essential to the program of development have not been met at the appropriate time in the past. However, this does not mean that Jung agreed with Freud that the origins of a neuroses invariably lie in early childhood. On the contrary, neuroses is caused by a failure to contend with contemporary circumstances. It may occur at any stage of the life cycle as a response to outer events, such as going to a new school, losing a parent, starting a new job, being conscripted into the army, getting married, bearing one's first child, etc. Earlier traumata may predispose the individual to exhibit neurotic symptoms, it is true, but such traumata are not the cause of the neuroses. Neuroses is, therefore, in Jung's view, essentially an escape from a challenging life event which the individual feels unequipped to meet. Consequently, he taught his students, when confronted with a new patient, to ask themselves, what task is the patient trying to avoid? Not infrequently, the patient's difficulty stops short of an incapacitating breakdown, but life is experienced as essentially unfulfilling and pointless. I have frequently seen people become neurotic when they content themselves with inadequate or wrong answers to the questions of life. They seek position, marriage, reputation, outward success, or money, and remain unhappy and neurotic even when they have attained what they were seeking. Such people are usually confined within too narrow a spiritual horizon. Their life has not sufficient content, sufficient meaning. If they are unable to develop into more spacious personalities, the neurosis generally disappears. For that reason, the idea of development was always of the highest importance to me. Jung's understanding of symptom formation as a creative act is of the highest value for the development of therapeutic optimism in both patient and therapist. For instead of regarding the symptoms as representing a form of futile suffering, it sees them as the growing pains of a soul struggling to escape fear and find fulfillment, as providing an invaluable opportunity to become conscious and to grow. Neuroses, he said, in the nearest he came to a definitive definition, is the suffering of a soul that has not found its meaning. Okay, I think I talked about, I'll read it anyway. The patient. Many patients who consulted Jung have testified to the cordiality, warmth, and courtesy with which they were received. His sense of humor, always in evidence, made it impossible for him to seem pompous or self-important, and he never attempted to disguise his own fallibility as a human being. For example, he greeted one new and deeply worried patient with a reassuring grin, saying, "So, you're in the soup too." He believed in treating people as human beings rather than as patients, and taught that every appointment was a social occasion as well as a clinical interview. For that reason, he never used a couch or any obvious techniques or tricks of the trade, treating everybody as essentially normal and healthy while accepting incidentally that they might have a problem. If the person has a neuroses, he said, that is something extra, but people should be regarded as normal and met socially. What struck most of his patients was the extent to which he was in the analytic situation, completely there, not aloof and out of sight, not a screen for projections, not a transference manipulator or a clinical manager, but there as a real person, wholly involved in the work, respecting the patient as an equal, not as a sick inferior. His keenness to abdicate all idea of personal superiority or of knowing all the answers went along with a willingness to acknowledge his own vulnerability in the belief that only the wounded physician heals. It's very important not to know all the answers, he said. Often we don't know, and if we did, it would be no good, for it is greater value to the patient when he discovers the answers himself. My own analyst, Irene Champernon, who was herself analyzed by Jung, told me that he gave you the feeling that he was there not just because he was your analyst, but because through you, he was pursuing his own research and that he too was learning from the process. This gave a sense of heightened importance to the proceedings. Jung himself acknowledged this in his autobiography. My patients brought me so close to the reality of human life that I could not help learning essential things from them. Encounters with people of so many different kinds and on so many different psychological levels have been for me incomparably more important than fragmentary conversations with celebrities. Above all, he never forgot that every patient was unique and that general rules, dogmatic ideas, and universal procedures should never be applied to him. Learn your theories, he taught his students. Then, when the patient walks in through the door, forget them. He was hostile to group therapy and to all mass-produced remedies. In dealing with individuals, only individual understanding will do. It will be seen that Jung's approach to a patient differed radically from that of the conventional psychiatrist who applies the medical model to all who consult him, focusing on the signs and symptoms of illness in order to establish what has gone wrong, make a diagnosis, and prescribe treatment, while always maintaining clinical distance and professional authority. Jung, on the other hand, approached the patient not from the standpoint of pathology, but from an anticipation of health and an effort to establish what can go right. His focus was on symbols and meanings rather than symptoms, discovering what archetypal needs had been frustrated and needed to be met, while relating to the patient through the personal intimacy and mutuality of the analytic situation. The essential difference between the two approaches is that the psychiatrist sees the patient as a victim of illness, the Jungian as a candidate for individuation. Treatment. The Jungian approach to treatment is again very different from conventional psychiatry. The psychiatrist is concerned to reduce suffering through the provision of medicine and support, whereas the Jungian encourages the patient to participate in his suffering so as to confront its meaning and mobilize the healing powers of the unconscious. To face the major issues of life can involve much pain, but this is a valuable spur to self examination, an incentive to wake up to one's predicament and grow beyond it. Jung once remarked of a patient, "Thank God he became neurotic." For in this case, as in many others, the neuroses was a call to attend to what was lacking or problematic in his life and to embark on the journey of self discovery and renewal. To the psychiatrist, overwhelmed as he often is by large numbers of sick patients, mental illness is an enemy onto which he projects his own sick shadow to be fought and overcome, a devil to be driven out. To the Jungian, the illness is a symbolic communication from the unconscious, indicating where the patient has got stuck in his efforts to meet the demands of the archetypal program for life. In a psychiatric clinic, the patient goes through the ritual of consultation, diagnosis, and treatment, colludes with the psychiatrist in becoming detached from his illness, and is encouraged to relinquish responsibility for his plight into the capable hands of the doctor. The Jungian, on the other hand, treats the whole patient, encouraging him to accept full responsibility for his circumstances and to understand his illness as an expression of his total life experience. He is taught to see his symptoms as arising from an unbalanced mode of existence, which is itself a result of thwarted archetypal intent. Treatment consists of helping him to recognize and find ways of correcting his archetypal frustration, abandoning his one-sidedness, and bringing about a new equilibrium between the opposing forces in his personality as a whole. To achieve this is not sufficient to confine himself to dealing with his conscious circumstances. It is essential to know the situation in the unconscious. Here, the analysis of dreams and the analysis of the transference become indispensable. The psychiatric approach is quite different. The aim is not to open up the unconscious or receive the message it has to convey, but to suppress it, to silence it with drugs. The goal of psychiatry is first aid and rehabilitation, to return the patient to the community. The possibility that a breakdown may be a crisis filled with existential meaning and an opportunity for growth is seldom considered. In fairness to the psychiatric profession, however, it must be acknowledged that Jung's patients, once he had left the Bogalzi, were hardly the run-of-the-mill intake of psychiatric practice. Most of them were educated well off and in the second half of life. A number of them were psychologically sophisticated in that they had already received some form of psychotherapy before consulting him, and a fair proportion of them had little that was psychiatrically wrong with them. About a third of my cases are not suffering from any clearly definable neuroses, but from the senselessness and aimlessness of their lives. I should not object if this were called the general neurosis of our age. To what did he attribute the general neurosis of our age? To a collective loss of soul, to a loss of contact with the great mythic and religious symbols of our culture, to the emergence of social institutions which alienate us from our archetypal nature. This is an extension of the view advanced by philosophers such as Diderot and Nietzsche, and later developed by Freud in Civilization and Its Discontents, that the benefits of civilization are brought at the cost of natural happiness. Jung believed that the more secular, materialistic, and compulsively extroverted our civilization became, the greater the unhappiness, senselessness, and aimlessness of our lives. What was the answer? Not a return to the church, for his own experience had taught him that, unless it came as Gnostic revelation. Organized religion meant spiritual death. Again, as a result of his own experience, he felt that we had no other recourse than to abandon the exclusively extroverted quest for meaning in the outer world of material objects, so typical of our culture, and instead establish contact with the symbol-forming capacities latent within our own psychic nature. What was needed was hard psychological work to open our minds to the inner wealth of the unconscious in order to realize in actuality our own capacity for wholeness. In the process, meaning and purpose flood back into our lives. Jung divided analysis into four stages, which inevitably overlap and certainly do not always proceed in a regular order. 1. Confession. This is the stage of initial catharsis when one shares with the analyst the secrets one has been carrying. This is usually associated with feelings of intense relief, of shedding a burden, of discharging a load of poison. Guilty feelings are reduced, as are feelings of being isolated, inferior, and beyond the pale. The integration of the shadow begins. 2. Elucidation. This is roughly equivalent to Freudian interpretive analysis. Symptoms and transference phenomena are examined and areas of failed development located. Radical transformations are rare at this stage, but serious work with the unconscious has started. 3. Education. The insights gained in stages 1 and 2 are now plowed into life. One begins to experience oneself differently and to explore new modes of existing. This usually goes along with an improved adaptation to the demands of society. 4. Transformation. Work with the unconscious brings one face to face with the shadow, the anima or animus, and other archetypal components which are activated as a natural homeostatic compensation for one's previously narrow, neurotic, or one-sided development. At this stage, the transcendent function of symbols comes into its own. The individuation quest is now underway and is associated with coming to selfhood, a state reaching beyond mere normality or social adaptation to a full affirmation and acceptance of oneself as a whole entity in one's own right. I think I'm going to stop it there.